70% of chronic diseases are preventable. People don't realize that they can use the traditional medicine and these herbs. My dad was born in a very small village called Kipuzi in Congo. He told me about how the health system worked in the village. So it's different, there's no hospital, but still people were able to live longer, to the hundreds and more. Growing up in the city, any illnesses, you will go straight to the GP, to the hospital. I really felt like I've missed something. I was diagnosed with liver problems. I was seeing a consultant who was treating me, but it wasn't improving. At the same time, my dad was having similar issues, but it was more serious. When my dad found the traditional healer who told him about the Tetradenia Riparia leaves, which has been used traditionally to treat a lot of illnesses and ailments. He tried it, it worked on him, and asked my dad to send me some samples. When I got the samples, I started trying them in the kitchen, trying to make different products. I tried it and it worked, and I decided to look into it further and approach the university.
Through conversations with Frank, he actually had a list of plants and herbs that he was aware of that had been used traditionally in Africa for various afflictions and diseases. But what we planned to do from HTC's point of view, from Swansea University's point of view, was to look at the scientific background on these various food products, plants and herbs, and to see what knowledge was already known, what had already been proven, what had already been tested surrounding them, and what properties that they potentially had. I remember looking at one in particular, which was Tetradenia Riparia, and the wealth of sort of scientific research that had been done on that plant and different elements of that plant, compounds, extracts, showed various health properties that it could potentially have, including antiparasitic, antimicrobial, anti-inflammatory. So we're sort of a partner that we work with Frank as much as we can to help him look at the scientific landscape behind each of his elements that he wants to put into his products, to establish what's already known about their medicinal uses in modern medicine.
That kind of gave me the green light. After that, we decided to start creating health products, and we approached the food centre Wales.
So Frank came to us with a really exciting and innovative product, and he had a really clear idea and vision of what he wanted to get to market. So then we were able to step in at that stage and help him with all the technical and legal requirements of getting a product like that onto the shelves.
These ingredients have been used for generations in East Africa and South Africa. I'm just on a mission to share this knowledge that people in Africa have known for many years, and I just want to share with more people and the younger generation, so that they can be aware of these health benefits, so that in the future they can have a much better health than the current generation.